pay for our malpractice. Another thing the state does is all of the attendings and medical students and residents in the medical schools get free coverage. The state already covers them. So we're taking these two programs and sort of combining them and just saying, look, take what the federal government is doing. They're deeming the different doctors that work in the free clinics, just extend that coverage to their own practices. And it's the same coverage that you're already given to attendings in the medical schools. There's really nothing new in this. We're just kind of realigning some things. But we would save the taxpayers just a boatload of money. The taxpayers would win, patients would win, they get sick, they don't know what to do, they have no insurance, no money, there's a free clinic down the street. No bureaucracy, nothing gets in their way of getting care. So unlike now, Medicaid, people can't find a doctor. In fact, the Medicaid office actually sends us patients in our free clinic. They refer people to our free clinic because they know the patients can't find a doctor. So interesting. So that's that part of it. We would save so much. The taxpayers would save a lot. The doctors would save. That lowers their overhead. And then the patients can find a doctor. And you're putting it together. How would we get these free clinics set up? Baby boomers. How many are retiring? 10,000 a day are retiring. And these are people with experience, with, you know, they've got drive, they've got, you know, they want to solve problems, they don't want to watch their kids go bankrupt. So they're motivated. In fact, we just moved, our little clinic was 900 square feet. They got us out of the floodplain, and volunteers worked, and we got it, a new building retrofitted to make it into a nice clinic. 5,000 square feet. We just moved this past week into the new facility. It's going to be amazing. We're going to get medical students in to teach, and we're going to get, we'll have more room for counseling. So when these people come, we'll find out more about what their problem is. It's not just that they need something for their sore throat. Sometimes they're hungry. We have a food bank that's right nearby. Clothing we have for them. We have support groups for the single moms. We've got all kinds of ways to help the poor. Our goal is to get them out of poverty and to figure out if we can do something to help them. And they become connected, and that's why our church has gone from 150 to 2,000 in the past 7 years. It's huge. Yes, he did. Bernie Sanders did hate me. In fact, you know what he did? And when I was there, he said to me, he's a socialist, he said, oh, very good, I commend you, Dr. Reck, for what you're doing in your clinic, but I really think doctors should be paid. Right. And then he said, do you believe that people have a right to health care? That was a trick question. Right, so my answer was, anytime somebody has a right, if it requires somebody else to be obligated, that's not a legitimate right under the Constitution. And then Rand Paul went off on a rant about the whole idea of healthcare being a right and making us into slaves, and that was very interesting. And that was when Napolitano picked up on it, because that's something he would really like, Judge Napolitano, and that he called me into New York City, and we just talked about it, and I talked about the two different...
You're cutting out Bernie Sanders' ability to give out do-nothing jobs.
That's right. I mean, the amount of bureaucracy. We pay 49 people in New Jersey to look for fraud and abuse in the Medicaid system. That's 49 full-time jobs with benefits. Yes. We're going to get rid of those. Yeah. There's a huge bureaucracy associated with the Medicaid system. That's where the money's going. It's not paying doctors, and it's not really providing health care. Yes?
How many clinics are involved in New Jersey at this time? Just yours?
No, well, there's at least 3. There's one up in North Jersey, Bergen Healthcare, Bergen Center Volunteer Clinic. Then there's one, the Parker Health Center down in Red Bank, of which John Bon Jovi put up the building, because that's his town. Now we got to find a lot of famous people like that, and they'll put up a building here and there and everywhere. We figure we need about 100 of them to be set up, and it's not hard. In fact, you could set up one around here. It's really not hard. What you need is one doctor who sort of gets the idea and wants to do it, and then a really good motivated, like a person who would be out there for publicity, and then somebody who's a nuts and bolts kind of person, kind of like you know, how to do websites and all the little details. But it's really not that hard. And if this law passes, we're going to have doctors looking for places to volunteer. And think about it. you have a clinic now, and you got all the different specialties converging. You know, maybe there'll be orthopedics day will be one half a day, and there'll be a cardiology half a day, and so forth. Volunteers will love to be around there. It's just a really exciting environment where all the different specialists are coming. You're going to find out who's nice and who's good and who really seems to care. And you know what's going to happen to those doctors as they go back to their practices? You're going to remember that nice doctor. And the doctors are going to, their private practices will start to do much better. Instead of being this whole bureaucratic, doctors have gotten a very bad rap in the whole system. But we don't find that personally. We find that people are so grateful, and it's such an uplifting environment when you have a free clinic like that. So I think once the law passes, there'll be no shortage of them. We have another one starting down in South Jersey. There's a Dr. Valeri, who's actually running for the assembly, and he's facilitating the starting of a clinic down there. And then there's a church up in Basking Ridge that's saying, yeah, we'll do that. We have a couple rooms, we can do it. There's a group called echoclinics.org, which was started down in Texas by a philanthropist, with a billionaire, Texas billionaire, also very kind and compassionate and giving. He started this organization to facilitate the starting of free clinics. He wants 10,000 free clinics by 2030. Perfect. We'll take that. And then he helps them get their federal, their 501c3 status, and they help them with getting this Federal Tort Claims Act medical malpractice coverage. They look at our idea and they go, yeah, that would do it, because they could see that doctors would be motivated to work. It is hard for us to find volunteer physicians, because doctors really, despite what you might think, it's very, very hard to be a physician nowadays. You know, the amount of payments that the government programs are giving is going way, way down. And I mean, Medicaid is terrible. They wind up seeing people for free. It's actually cheaper to see people for free than to take Medicaid. And there's just a limit to how much you could do that and still pay your overhead and still, the surgeons, they're going into the OR, and they have full liability. And somebody comes in, you know, has no money, they just wind up having to take care of them. Women come in all the time, obstetrics, haven't had no prenatal care. They show up for a delivery. Something goes wrong, doctor's liable. It's really a very toxic environment for physicians right now. This would reverse that. And you know, you don't want to lose doctors. 400 obstetricians stopped obstetrics last year in New Jersey. In fact, what they're doing right now is they're following people up to about 7 months, and then they say, okay, now when you deliver, just go to the ER and somebody there will do your delivery. I can't, because they're not able to afford the $100,000 malpractice coverage.
Is it West Virginia that has none? There's one state, I believe.
Has no?
Yes, you have to leave the state.
Yeah, no obstetricians.
Yeah.
I'm not surprised.
Yeah.
I'm not surprised at all. So we need to reverse that. Just stop it. These wonderfully trained physicians are just going, I'm not allowed to do what I'm taught to do.
I don't mean to interrupt, but I have a number of customers who are doctors who have all time, oh no, I'm telling my children not to go into medicine.
Isn't that sad?
It's a shame.
Yeah.
Yeah, our fourth child, the boy, is the last year of medical school, and we just have vowed to him, we're going to fix this. We have to fix medicine, because we're all going to need doctors. So I've got these cards. I have a whole supply, and I'd love if each of you takes 10 of these and just starts giving them out. And what you can do, you go to the website, and there's a place for physicians, for interested, concerned citizens to sign up, or for people that might want to start a clinic or think about it, sign up, put your name and address, and let the legislators see how many people are interested in doing this. Talk to your legislator.
There's another interesting issue here, and that is to say that the projected, we have now projected that 30% of companies will stop offering insurance by 2014. 30%. So of those who are insured, they're going to say, under Obamacare, let's see, it's going to cost me $15,000 to insure. Maximum out-of-pocket fine will be $2,000. Tell you what, I'm dropping.
I'm paying the fine.
I'm not. So what we're seeing, we think, what will happen is many people are going to start saying, why don't we have a charity, a clinic? Why? Because if you're too sick to work, you have insurance, you will lose your coverage when you need it the most.
Yes.
Can you imagine? Half the people who are bankrupt now are bankrupt because of health care, and they had insurance when they got sick. Now think if you had a good charity clinic, that's insurance, whereas those companies that are scamming and cherry picking, they're going for the low-hanging fruit. That's not insurance. So what we tell people is you back a local charity clinic, they can actually negotiate your hospital bill for you, get just as good a rate. You can get your church, your synagogue, your group, your company, everybody pitches in, done. All you have to do is say, I want to be a sponsor of the local clinic, make sure this is done, so you're taken care of. It's a 501c3, fully tax deductible. You are taking care of the indigent. This is safety net. Obamacare is not safety net. And the insurance companies know that they're cherry picking. In 1988, when I was still doing surgery, I would do a gallbladder, laparoscopic gallbladder. The surgeon would get paid $2,500. The assistant would get paid $600. So 1988. Today, the surgeon gets paid $600. The assistant gets $0, and the premiums have gone from $300 to $3,000 for the same type of coverage. Where is the money? Where is the money? Why are our businesses leaving the state? Why are our property taxes going up so much? Why are we marching in Trenton saying that our premiums on our health insurance went up 45% in the last 2 years? And your property taxes can't, and the unions can't handle it. Why don't we have a good solution like this? Simple, to the point.
Because there's not enough people getting a benefit out of it. Well, I can use a perfect example. It's a semi-running joke. My father used to say, welfare treated him well. My mother worked for Middlesex County. When Revlon, where he worked, kicked out, he went and state trained him, and he finally got a job at Middlesex County Board of Social Services working on their computers. He used to have to go to Robert Wood, St. Peter's, a couple of the Raritan Bays. The women who were there to handle the Medicaid averaged, lasting there 5 months before they had to rotate them out, because literally they'd start going nuts because they'd see, in some cases, the same people in constantly for something that was little. They did palliative care to take care of it until it turned into something major. And I'll give another example. One of the problems where maybe this would help. I had a buddy work landscaping. His bosses, this was their system of workers' comp. Guy gets hurt, dump him off in the emergency room and run like hell. And he'd say it proudly. He says, I pay him cash. He says, my workers' comp, he says, they get hurt, I dump them in the local emergency room and leave. But he would sit there and moan and groan about, oh, it's costing him for this insurance and that and the other thing. And it's like, don't you listen to what you say, or think about what you're doing is a causary to it? Like, well, I live in New Brunswick. Is how can you have a house? We had one, I use this as an example of 2 houses burned, 98 people displaced, 3-floor houses. Well, none of these people were working. Where are they all going for their health care? So that's where the money's going. And you figure somebody is getting a payoff out of it. You said the 49 people that are running down the Medicaid fraud. Sounds like a lot. They're probably being paid well. What is the official population in New Jersey? 7 million. So you figure if 1 in 7 is on that, that's 1 million people that are going to be chasing around. And you know that there's more than that many people living in New Jersey with all the illegals that are not known. So, yeah, the charity would work.
This would work.
Nobody's getting a benefit out of it. The politician's not getting a benefit out of it. The local power brokers.
The lawyers won't like it.
That's
Yeah.
why we're here.
Think about the people that won't like this. It would be like the HMO administrators will not like this. The lawyers will not like this.
Right.
People who are making money on the current system, and it's my opinion that you shouldn't make money off charity. If you're giving charity, it ought to be charity. Like you're giving because you care, and it shouldn't. The government shouldn't be involved.
Am I right, or am I wrong in my thinking that some of our hospitals have closed because of the charity care that they've been required to give?
They've
And
closed.
I'm thinking like Muhlenberg and Southampton.
I'll tell you what's happened to the hospitals. A lot of them have kind of joined forces. They've become very big companies. And if you got one that's in an inner city area where it's mostly Medicaid, it's true, Medicaid doesn't pay enough and they go under. So that's why Muhlenberg closed, and they pushed the people into JFK.